Hi, I'm Marianne, reflexologist at the Leavenworth Yoga Co-op. Many of my clients ask me what things they can do at home for self-maintenance in between clinical reflexology sessions. Now, while a self-treatment can't fully replace a clinical session, it can help to decrease the frequency and the subsequent cost. So hopefully these things will help both you and your bank account. And the first tip I have for you is to treat yourself to a foot bath. You don't need anything expensive to do this. I got this plastic tub at the local grocery store for about $1. Throw some marbles in the bottom. I like to use varying depths. Just use whatever you have around the house. You can even use those flattened marbles that they use for decorative purposes in flower arrangements. Throw those in there with about 1/4 cup of Epsom salt and some warm water. You can dig your toes down in, roll them across the top, whatever feels good to you. If you're familiar with essential oils, go ahead and add some of those to the tub. If you're unfamiliar but would like to learn more, come on in and talk with me and I can tell you how to properly use them, as well as which oils would work best for you and your condition. Now, there are several tools you can use at home to work on yourself. I know from experience it can be tricky to manipulate your own feet. So there are a few tips and tricks I can show you. First of all, you're going to be using your fingers, mostly the first and second fingers here, to work most of the reflexes. And I'll show you a few of those techniques coming up next. Since it is harder to gain leverage, when working on yourself, you can use your knuckle because you are able to sense if you're going too deep. Do be aware if you're working on a loved one, this can give you almost too much leverage, so listen to them, start out soft, gauge it properly. Another handy tool is a pencil with an eraser on it. Simply lock it onto the reflex, do little circles, dig it in, whatever you need to do to break up that congestion. Another easy thing to do is keep a water bottle around. You can keep this under your desk at work. Just keep it lukewarm, or if you want, you can throw it in the freezer, fill it up with warm water, and simply roll it under your foot as you work. Next, I'm going to show you a few specific hand and finger techniques that you can use at home. Okay, really quickly, I just want to remind you one of the major differences between reflexology and massage. With massage, you're stimulating the pleasure sensors in the skin. With reflexology, you're going underneath those, below the surface of the skin, and breaking up the congestion on the nerve endings in the foot. So the calcium deposits, uric amino acids, things like that. So if you're going over the foot and you feel like grit or sand under the surface of the skin, that's one place where you want to pay extra attention. It might also feel like extra dense tissue, or it might, the person you're working on or yourself that just might be more sensitive. That's how you know where you're going to be working. The first technique I'm going to show you is the thumb walk. This is what you're going to use most often. You want to only bend at the top joint to give you the best leverage. You're going to use the other hand to brace your foot and bend and straighten at that top joint, much like a caterpillar walk. This is especially good to do across the center of the foot here. This is where you have all of the digestive reflexes, the upper GI up here, and then the intestines and colon down here. It works great if you come in at a diagonal to hit those reflexes, and then once you lose leverage, go ahead and come in from the other side. Another nice thing to use is called circle penetration. Again, you're going to use the thumb. You're going to lock on, bending at the top joint. Use your other hand to brace the foot. You're going to lock on and do small circles. This works great right here on the pituitary and pineal reflex, and all of the sinus reflexes and brain reflexes across the pads of the toes here. You can also do a back hook if you have a particularly stubborn reflex. You're just going to lock on with the thumb bent and pull backward to kind of break up that congestion there. Another technique is the finger walk. This is similar to the thumb walk, but use your finger. I really don't use this too often working on myself for leverage reasons, but I do use it coming across the top of the foot here. You have the fallopian tubes here if you're a woman, and also the lymph nodes through the groin area. You're going to, again, only bend at the top joint to give you the best leverage and do a bit of a caterpillar walk from ankle bone to ankle bone. A few particularly good reflexes to work at home are the pituitary and pineal reflexes. They're found right in the center of the pad of the great toe. Also, the solar plexus reflex can be great for stress relief. If you follow down between the first and second toe and down at the base of the ball of the foot here and press in there, that can bring great relief for stress. Also, the adrenal reflex, if you continue on down through the first and second toe and draw a line from that bone over here come across where they meet, that's about where the adrenal reflex is. Those are both great for stress relief, and the Center for Disease Control estimates that about 90% of illnesses that are taken to doctors are caused by stress. So by working those reflexes there, you can greatly improve your health. One other tip I like to give to my female clients is when it's that time of the month and all you want to do is curl up into the fetal position and not do anything, go ahead and do that, but also kind of pinch. You have the reproductive reflexes found on either side of the ankle bone here. You're going to want to pinch with your knuckle and your thumb. Just hold on either side. That will help significantly decrease the cramping and bloating that you experience. I hope that these techniques give you the skills that you need to do an effective home treatment on yourself or on a loved one. If you have any questions, you can go ahead and email me at serenesoulreflexology@gmail.com. You can also look on my blog, serenesoul.blogspot.com. There is a foot and hand chart there to show you the reflexes if you're unsure where to work. Or you can come on in for a private session and I can draw with a pen on your foot where the congestion is so that you can effectively work that at home. If you have any questions, feel free to give me a call.